So, good day everyone. My name is Marcia Beatienza. Today I'm going to report it's all about Zolanger-Ellison syndrome or ZES. So, what is the definition of Zolanger-Ellison syndrome? So, it's a rare conditions of tumors. So, what is Zolanger-Ellison syndrome or ZES is a condition that occurs when one or more tumors linked called gastrinomas linked, which are located mainly in your pancreas or duodenum, cause your stomach to make too much acid. They release the hormone gastrin. This causes the stomach to release too much acid. Stomach acid is needed to break down food, but too much acid can can cause painful peptic ulcer. In ZES, the ulcers are usually in the first part of the small intestine or the duodenum, and sometimes the second part, the jejunum. So, naadri dapit kaning green bitaw. Okay. So, what causes Zolanger-Ellison syndrome? So, unsay causes nga nung magka-Zolanger-Ellison syndrome di ay? So, caused by tumors called gastrinomas. So, the tumors cause the release of too much stomach acid. So, ang tumors nag-release dahil siya stomach acid. So, the extra acid can cause painful peptic ulcer inside the lining of your small intestine. So, who is at risk of Zolanger-Ellison syndrome? So, kasagara sa risk sa Zolanger-Ellison syndrome is 30 to 50 years old. So, just about anyone can get ZES. So, but some people with the condition may have a genetic problem known as multiple endocrine neoplasia type 1 or mini. Children of adults with mini are at a greater risk of getting the disease. So the ZES is more common in men, often those 30 to 50 years old. So mao gyud na siya ang kasagala nga makuanan sa Zolanger-Ellison syndrome kay lalaki din ang age gap niya is 30 to 50 years old. So what are the symptoms of Zolanger-Ellison syndrome? So the symptoms of ZS are similar to those other ulcers. So, ang Zolanger-Ellison syndromes, similar sila sa ang iyang symptoms is similar sa other ulcer. So, but often, no more severe and associated with diarrhea. Other symptoms include nausea, vomiting, nasulod gyapon niya ang weight loss. So, ang weight loss is ang ang Zolanger-Ellison syndrome maka-weight life ang iya hapud ay kuan ay kanaang sanaoy makabawas pud siya dahil siya timbang. So, belly abdominal pain, sometimes burning in nature, severe heartburn, or gastroesophageal reflux disease or GERD. So, intestinal bleeding such as black or tarry stool or blood in the stool. And malnourishment. So, isa sab siya nga ang symptoms is malnourishment, loss of appetite, dyspepsia, and severe diarrhea. So, what are the possible complications of the Zolanger-Ellison syndrome? In most people with ZS, tumors grow slowly and don't spread quickly. If you can manage the ulcers, you can enjoy a good quality of life. The 10-year survival rate is very good, although few people do get a more serious disease. So, how is Zolanger-Ellison syndrome diagnosed? If you have symptoms associated with ulcer or ZES, your healthcare provider may measure your stomach acid levels. So they may also give you a blood test to measure your level of the hormone gastrin. This is to see whether your body makes too much. Other blood tests and acid stimulation tests are often used. Your healthcare provider may order imaging tests to look for tumors. So, the pathophysiology. So due to various etiological factors, next is excessive gastric acid secretions. Next, result of gastrin producing gastrinomas from delta cells at found in the pancreas. So next is gastrin directly stimulates pancreatal cell secretions and also causes expansion if the mass of parietal cells. So increase in basal acid output and maximal acid output. So result in gastroesophageal reflux disease and managed to the mucosal lining of the GI tract causing peptic ulcer. And lastly is which contributes to diarrhea is diarrhea and malabsorptions or lipid soluble nutrients. So how is Ehlers-Danlos syndrome treated? So medicine called proton pump inhibitors can help manage the extra stomach acid. This medicine helps to stop ulcer from developing. So they include isofamazole, isomip- isomeprazole, lansoprazole, and pantoprazole, dexlansoprazole, and rabeprazole. And lastly is omeprazole. In some cases, surgery is needed to remove tumors in your digestive tract. In the most severe cases, including with tumors have spread to other parts of your body, your doctor may give you a chemotherapy to destroy them. So, ang doktor sab kay maghatag og chemotherapy to destroy them. So, na-involved din ana niya ang pag-treatment sa ZS is ameliorating the signs and symptoms related to hormones overproductions, curative resections of the neoplasms, control tumors growth, metastatic disease, and PPIS are the treatment of choice and have decreased the need of total gastrectomy. And next is octreotide may be considered as adjunctive therapy to the PPI in the patient with tumors that express somatostatin receptors and have peptic symptoms that are difficult to control with high-dose PPI. And lastly, the ultimate goal of surgery would be to provide a definitive cure. Therapy of metastatic endocrine tumors. So, chemotherapy is or streptozotocin, 5-fluorouracil, and desorbicin or IFN, hepatic artery embolizations, and radiofrequency of cryoablations of liver. So block the vascular endothelial growth receptor pathway or bevacizumab sunitinib and debulking surgery, and lastly liver transplantation. So favorable prognostic indicator. So primary duodenal wall tumors, isolated lymph node tumor, and undetectable tumor upon surgical explorations, and poor outcome, patient with shorter disease durations, higher gastrin levels, and large pancreatic primary tumors or 3CM, metastatic disease to lymph nodes or liver and bone, crushing syndromes, rapid growth of hepatic metastasis, and when should I call my healthcare provider? So ZES can sometimes be served with severe complications if left untreated. If any of symptoms last for more than a few days, see your healthcare provider for a diagnosis. If you have any signs of intestinal bleeding such as black anti-stool or blood in stool, call your healthcare provider. So Table 287 in sensitivity of imaging studies in Zolanger-Ellison syndromes. Sensitivity percent. So, ang study niya is ultrasound, primary gastrinoma, metastatic gastrinoma. So, ang ultrasound is 21 to 28, then metastatic is 14. The CT scan is 35 to 59, the metastasis is 35 to 72. Selective angiography, primary, 35 to 68, and metastatic is 33 to 86. Portal venous sampling 70 to 90, or metastatic NA. So, SASI 55 to 78, metastatic 41, MRI 30 to 60, metastatic 71, Octreoscan 67 to 86, metastatic 80 to 100, and EUS 80 to 100, and NA. So, nursing management or nursing diagnosis. Anxiety related to the disease anticipated treatment. Imbalanced nutrition less than body requirements related to early satiety or anorexia. So, acute pain related to tumors mass. So, intervention or reducing anxiety. A relaxed, non-threatening atmosphere is provided so the patient can express fears, concern, and possibly anger about the diagnosis and prognosis. So, next is the nurse encourage the family to support patient. So, ang nurse mag-encourage po siya sa family para suportahan ang patient nga ng sakit or anxiety, offering reassurance and supporting positive coping measures. The nurse advised the patient about any procedures and treatments so that the patient knows what to expect, and promoting optimal nutrition. Encourage him to eat small, frequent portion of non-irritating foods to reduce gastric irritation. Food supplements should be high in calories. So, if the patient is unable to eat adequately prior to surgery to meet nutritional requirements, parental nutrition may be necessary. So the nurses may monitor the IV therapy and nutritional status and record intake output and daily weight to ensure the patient is maintaining or gaining weight. So the nurses assess for the dehydrations, decrease urine output, and reviews the results of daily laboratory studies to note and metabolic abnormalities. So lastly is the relieving pain. So the nurse administered analgesic agents as prescribed. So next is cutaneous IV infusion of the opioid of PCA pump sent to infuse an opioid may be necessary to mitigate postoperative pain. And lastly, the nurses routinely assess the frequency, intensity, and duration of the pain to determine the effectiveness of the analgesic agent. So that is my report about Zolander-Ellison syndrome. That's all. Thank you.